Yellow flags, also known as the reason for unsuccessful outcomes. Look, whilst they exist, there is too much emphasis on yellow flags. I'm concerned that all too readily, in the event of an unsuccessful outcome, the conclusion is that the patient's psychosocial factors are insurmountable. The biggest yellow flag is the belief that cervical afferents are not involved in the migraine or headache process. No, we need to take a hard, long look at whether we're prepared to accept elementary neuroanatomy and what the current research is telling us, and that is that cervical afferents have the potential to sensitise the brainstem. The number of times I've been told, well, we don't know what causes migraine, but it can't come from the neck. I'll repeat that. Well, we don't know what causes migraine, but it can't come from the neck. What a ridiculous statement. If you don't know the source, how can you disregard a possibility? Furthermore, an international authority has commented, and I quote, "In migraine alone, the extremely common premonitory symptom of neck discomfort or pain leads to endless and almost invariably useless therapeutic attention to a structure that is as innocent to pathology as are the eyes innocent to pathology in patients with photophobia." Secondly, that because the condition is chronic and therefore central sensitisation is likely to be present, the assumption is that the initial peripheral sensitising source is long gone. We need to face an unpalatable thought. Instead of blaming the patient's depression, beliefs, social, vocational situations, anxiety, etc., for lack of progress, perhaps it is because of our lack of skill. It is amazing when headache or migraine is improved significantly, how often depression lifts, anxiety diminishes, beliefs are changed, only to be replaced by anger because the patient's realisation that they've been mismanaged. Besides, what do beliefs, social, vocational situations, depression, etc. have in common with unilateral alternating headache, which is a musculoskeletal event, and I'll talk more about this later, and or reproduction and resolution of headache? A skilled practitioner knows exactly what the physical examination is going to show based on a subjective presentation. If it doesn't, then maybe, just maybe, yellow flags are in the picture. The vast majority of those experiencing headache or migraine are struggling, not because of the yellow flags. Hey, redundancy, divorce, anxiety, depression doesn't help, but it's because they're being mismanaged. In the headache and migraine world, yellow flags are not a significant issue.